Americans and everyone abroad. Today is March 22nd, 2020, and on behalf of Community Action Now, we're having a series of COVID-19 updates. Community Action Now is an organization that provides the underserved communities with resources to combat poverty. It also assists with youth advocacy, disaster management, education, and other outreach services. Since 2014, Community Action Now has assisted the Virgin Islands and the Eastern Atlanta metro area. And we've also decided to, I apologize, my name is Angel Bolquez Jr. I am the advisory board chairman, advisory board of Community Action Now. As to COVID-19, Community Action Now is providing a series of COVID-19 live updates and information to provide to the community. Today, Community Action Now is in partnership with Philadelphia College of Osteopathic Medicine and Professor and an infectious disease expert, Dr. Valerie Cadet, will be joining us today. She was actually on our last live, giving us a lot of information concerning COVID-19. This episode that we're providing today will be basically about the myths concerning COVID-19, because there's a lot of misinformation out there. I'm sure a lot of you have been taking your time out to research COVID-19 and figure out what's going on, how it spreads, how can I, be safe, how can I make my family be safe. But there's a lot of misinformation out there as well. And I'm so happy that Dr. Cadet is here with us today to answer some of these questions and provide knowledge on the situation. Dr. Cadet is no stranger to Community Action Now. She has assisted in the support of medical evacuees from the Virgin Islands to Atlanta, Georgia, following the hurricanes Irma and Maria. And she's also a board advisor to Community Action Now. So with further ado, Dr. Cadet, how are you doing today?
I'm great, thank you. How are you?
So far, so good. I can't complain, and I'm so glad that you're taking a time out to assist us with these live updates to provide information to the general public, as it's very important because knowledge is power, and we need to know how to protect ourselves in this desperate time. So before I start with my round of questions, I just wanted you to introduce yourself to the listening and viewing audience for those who may not know who you are.
Sure. Well, I am here in Atlanta, Georgia area. I'm an associate professor of microbiology and immunology at PCOM, Georgia Medical School in the area. My background is a PhD in infectious diseases, where I work with viruses, vaccines, and immunology. And as you mentioned, I'm here just to answer questions. There's so many questions that people have, and there's a lot of myths. So we thought, when you presented the idea of trying to attack some of those myths to keep people safe, I thought, that's a good idea.
Yeah, thank you. And I guess we can just get started, and I'm gonna ask some questions, but no question is a stupid question, because we all need to understand that we need to educate ourselves and be vigilant of the situation. So a question, is coronavirus comparable to the seasonal influenza?
So that's a yes and a no. So there are some similarities to seasonal influenza. And what we're looking at in terms of similarities, okay, first of all, the symptoms. These are both respiratory viruses. So they transmit in similar ways, that's through coughing, sneezing, those respiratory droplets that people are exhaling, as well as then other people may come along and either inhale or touch on a surface and then, expose their eyes, nose, or mouth. So that's a similarity. Another similarity with their symptoms are both of them are going to cause fever, coughs, body aches, fatigue. Both of them actually could cause vomiting and or diarrhea too. In both cases, you can have mild disease or you could have severe disease, and there are definitely mortality associated with both COVID-19 and flu. And rarely influenza can result in pneumonia. And with COVID-19, we're seeing that in some cases, of course, we're having this deep lung disease, pneumonia. In terms of treatment, So neither of these, because they are viruses, neither of these can actually be treated with antibiotics because antibiotics are targeted for bacterial infection. So both of them basically are treated with, in terms of addressing their symptom. So just supportive care. Let's reduce the fever. And then, as cases get more severe, individuals might require hospitalization and additional, support such as ventilation. They differ in that influenza does have a couple of antivirals that are specifically targeting flu virus. And, they're not going to work. So a question I keep hearing is, well, can't we just use flu medicine to treat COVID-19? And we can't. It's a different virus altogether. So that wouldn't work. And right now we have no treatment specifically for COVID-19. Additionally, there's no vaccine for COVID-19, while for flu, we have a vaccine, which helps slow the spread of flu through the population. But we have no vaccine. Nobody's been, treated. We're all sort of unfolding at the same time. So nobody is immune to it yet, unless you've already experienced the disease just now, in the recent weeks or months. Then you're not immune, and therefore it's very difficult to run through the population. I wanted to point out one more thing here in terms of how are they similar, because people keep harping on this. Well, they're similar because for both of them, we work to prevent the infection by washing your hands really, really well, by coughing into the crook of your elbow, by staying home when sick, by limiting contact with people who are actually infected. A major difference though between, how this works with influenza versus how this works with COVID is that with influenza, when somebody's infected, they're going to start to feel pretty bad within a day. They're going to feel pretty like really bad within 2 days, usually, right?
Yeah.
So you're not walking around basically spewing viral particles and getting other people infected for a long period of time before you're sick. With COVID-19, you're actually able to do this for up to 2 weeks, before you even know you're sick. So that's huge because now all of a sudden you're able, number one, the virus is more contagious than flu. And you're able to spread it to more people because of just how long you're out and about having no clue that you are sick, to potentially sick. And so that's regardless of symptoms. And so then that brings us back to prevention. This is why we really need to wash our hands, disinfect all surfaces, and really stay vigilant about remaining, that 6 feet distance between each other. And if I can elaborate, a lot of people have asked me, well, why are we talking about 6 feet? It's not an arbitrary number. So as we're talking, breathing, you're sneezing and you're coughing, you're actually exhaling these respiratory droplets that have the virus inside of it. When you're doing that, it's estimated that those droplets are going to land anywhere from 3 feet to 6 feet away from you on surfaces, or, some of them may hang out in the air for a period of time. So when you come into contact with somebody who may be infected because they have no idea, they're not, exhibiting any symptoms and don't feel bad, then you may actually, within that 6 feet window, be exposed to those respiratory droplets.
Okay. Okay. Thank you. Thank you. And here's another question. People say, right, that the virus cannot survive in extreme heat. So if so, because I've seen a lot of videos as well, I do my research as well. They say that you can use a hot air blower and breathe in hot air and all of these different myths is what I would call them at this point, unless I'm otherwise told by an expert like yourself. But will the coronavirus, if that is true, I apologize, will the coronavirus go away, like per se in the summer when we have hotter temperatures?
Well, again, because this is brand new, we can't say definitively one way or another. So
Okay.
based on what we know about respiratory infections, they are less active. So respiratory viruses are less active in the extreme temperatures of summer, usually not, so where you guys are located, of course,
Yeah.
it's going to get really hot. They are less active. That doesn't mean that they go away completely. Um, you are correct, and there's partial truths in some of the stuff that you see, in that these viruses don't, they aren't as viable, meaning there's not as much virus that's actually able to go on to infect others at the higher temperature. But we're not there. We're not
Okay.
there yet. And even when we get to those really high temperatures, again, we don't know how this virus is going to behave because it's
Okay.
the first time we're seeing it.
So the virus is reactionary. It's very reactionary. So it's unlikely to figure out what it's going to do next until you go through the process, basically, right?
It is. It is. I mean, we have some knowledge about other coronaviruses and what that knowledge is that, similar to other respiratory viruses, it becomes less viable, so less active, but it doesn't mean it disappears completely, you know?
Understood. Hmm.
And so, yeah, you're right.
Okay, thank you. And here's another thing that I've researched as well. Can animals have or pass along the virus? And if so, like for instance, like mosquitoes, would they be able to transmit the virus as well?
So, okay, so let's start with the animals. So far to date, we have not seen and I'm thinking our domestic animals, like our cats and our dogs, our
Yeah.
household pets. We haven't seen transmission with our household pets. Having said that, the recommendation is absolutely that everybody with a pet, and I have two dogs in my house, when I am interacting with my pets, I'm going to wash my hands actually before as well as afterwards because is there a possibility? It looks like it's not going to happen, but again, because this is still so new, it's difficult to truthfully know 100%. But, for the most part, we're not panicked, but we are saying this is, that good hygiene that we need to practice to help prevent our own infections and
Mhm.
infections of others. Normally, that's always the recommendations that veterinarians will give when you are sick or if your animal is sick. Absolutely. Purell,
Yeah.
so you want to clean your hands and remember that, that goes both ways.
Both ways,
And
yeah.
in terms of mosquitoes, so there
Mhm.
definitely, as you guys know, there are certain viruses and bacteria that can transmit through mosquito bites. We have not seen that with coronaviruses. So, we don't anticipate that mosquitoes, especially as that, season ramps up, that mosquitoes are going to be transmitting this virus. Mosquitoes are, when they do transmit a virus, it's, a virus that they're going to go ahead and take from one person's blood and then go and inject it into another person's blood. But this virus, for it to truthfully cause the symptoms, it actually needs to be transmitted through your eyes, nose, or mouth and cause that respiratory syndrome, the respiratory
Okay.
symptoms, right? So most likely we're not going to see mosquito spread.
Okay. Okay. It is a concern. I know here in the Virgin Islands, we've had like a Zika crisis a few years ago. So, people are concerned. I've attended meetings where a few of my colleagues have posed that question and they were very interested in finding out what the answer would be to that. So thank you very much. My next question is,
Absolutely.
people say that drinking fluids, every 15 to 20 minutes will prevent you from, and there's this thing that they say you have to keep your throat moist. Don't let your throat get dry because you could develop that dry cough or whatever. But they're saying that you have to drink liquids every 15 to 20 minutes to prevent you from contracting the virus. Is this true or false?
That's false. And so it's, I feel like in every myth, there's like a nugget of truth somewhere. So if you are sick, respiratory viruses, if you've got a cold or something, think back to what your physician would say, what your mother would say, your grandmother would say. They would tell you just keep drinking, right? Stay hydrated. That's really, really
Right.
important to stay hydrated now, to stay hydrated when you're sick. It helps your body, your immune cells work better when you are hydrated. And of course, if you have a scratchy throat or you've got a sore throat or you're experiencing a dry cough, staying hydrated is going to make you feel better. But drinking every 15 minutes and staying hydrated specifically to prevent infection, that's not going to actually work. It is actually, in fact, a myth.
Okay. Okay. Interesting. So my next question, um, you can protect yourself from COVID-19, right?
Mhm.
In different ways by practicing social distancing. You make sure that you use your Purell hand sanitizers. You make sure that you wipe down everything in the house and things like that. But what I don't hear on the news is information pertinent to your immune system. And myself being a person that I have my regimens that I do. I'm more of a holistic type of individual myself. And my question to you is can you protect yourself from COVID-19 by boosting your immune system?
So, that's a good question, and that question's asked all the time. So can you help your immune system work better is really what this is. And so there are things you can do to boost your overall immune system functioning. But to be clear, there's no overnight, let me go and eat this thing or drink this thing, and all of a sudden that's going to protect me today. If I
Right.
encounter somebody, it's something that you should be doing kind of all along. So what could you do right now to help boost it? Because we're kind of in this for the long haul.
Yeah.
You want to be eating right, a balanced diet with fruits and vegetables that have, that vary so that you are running the gamut and getting your various vitamins. You want to get your vitamin A's, your C's, your E's. You want to get minerals such as zinc. Definitely don't want to forget vitamin D. Other minerals, so calcium, because overall, these things, along with uh, magnesium, for instance, they all serve a function in our bodies to help our cells work better. And so those things will work. So, yes, you can, if you're not eating a balanced diet, go and take a, supplement, a multivitamin supplement, but really the best place is from your diet. In addition to what you're actually ingesting, you want to sleep. Sleep is important, helping minimize stress. This whole pandemic at this point is stressful. I had to go to the grocery store. That is a stressful experience,
Yeah.
understanding
Yeah.
that I am out and I'm looking at all these people and they may be infected or they wouldn't know it. The entire thing is stressful. Right now, having to sort of self-isolate, that's stressful. There's so many things. Sleep is important. So sleeping actually helps reduce stress, and it helps to boost your immune system. So when you're resting properly for whatever that means for your body, then that's good. Another thing that you would want to do is, even with all this isolation and social distancing that we're doing, we are encouraged to go out there and exercise. And that serves a twofold purpose. Your body needs exercise, and that will help overall. There's a lot of things physiologically that can be boosted with general regular exercise. And we're talking, it could be walking. There's other things you can do. But also, if you're outside doing this exercise, you can get some vitamin D. We get that our body can make it from sunlight exposure. And again, that's a natural source of vitamin D that your body can make that
Mhm.
you actually need. So, when you start combining all of these things, then, and you're doing it diligently and remaining hydrated, that is how you're going to boost your immune system you know and then I do want to take a point, though, to be responsible when I'm talking about exercising outside. you know I don't know exactly where you guys are in the Virgin Islands in terms of your isolation and social distancing. However, what we're encouraged to do here is you can go outside and do things either alone or with people that are in your household. You still want to maintain that distance from others outside of your household. Otherwise, it's defeating the purpose of social distancing right now.
Yeah. Okay, good, good. And I think that this virus both brings us together and separates us
Yeah.
in a certain way. I think that we are gonna miss. I'm a bit of a socialite myself, so I miss interacting with people and learning from them and sharing ideas. So it is gonna change a lot of those different facets in our society. But I do think that it will bring us closer, because when we get past this, and I know that we will, because we're resilient people, but we will get past it, and it's going to bring a different dynamic in our society. And I just hope that that pans out to be a positive thing.
I hope
So
so.
I hope so too. I hope so too. So another myth that I keep hearing is that if you eat or drink garlic or ginger, or
Mhm.
ginger and garlic teas, it will kill the virus.
Okay, so nuggets of truth, but I've got to lean towards myth. So, in terms of nuggets of truth, we do know that garlic and ginger. And then there's a few other compounds do have natural antiviral and or microbial properties. So they are part of a diet. So incorporating them as part of your diet to, do an overall boosting of your immune system is not bad, you know. However, relying on garlic or ginger, or even, somebody sent me a video this morning of, you know, in the video it described slicing lemons and steeping that and making some, fresh lemon tea, which I grew up, drinking all the time.
Yeah.
That's it's wonderful, but that was supposed to be this 100% preventative in this video. These things are
Oh.
not correct. So all of these are, pieces, I guess, tools to help, keep you overall healthier. And yes, there is maybe a little bit of antiviral properties, but we don't actually know if those antiviral properties of garlic and, some of the ones with ginger actually extend to coronaviruses. The studies haven't been done. I did a quick search before we got on. I haven't been able to locate specific studies on these with coronaviruses. And even with the other viruses that I have seen studies on, again, they're not exclusively going to prevent infection. They're overall boosting and helping you.
Okay. Thank you.
Mm-hmm.
I think we kind of touched on this a little bit earlier, but breathing in like hot air,
Right.
or even like with lemons. I saw a video recently where there's individual was taking like lemon peels and an orange and different a concoctor of different lemons and different herbs or whatever to create sort of like a steeping steam.
Mm-hmm.
Whereas informational wise, we know that the virus cannot survive in extreme hot temperatures. And he was stating that once you steep these things, I mean, obviously you can't just do it once, but if you continue doing this, because he's saying that once the steam is in your body for at least 20 minutes, 25 minutes continuously, that it will kill the virus. So it's sort of a steeping measure or practice.
Mm-hmm.
And my question to you is that doing something like that, would that kill the virus?
Not specifically. So you've got this virus. Let's just imagine for a second that I've been exposed. This virus is already in my body. It's penetrated through my mucous membranes. It's penetrated in and it's gotten inside my cells. Now it's in there. When it's in the cells, it's replicating and it's going to make lots of new virus. Our cells turn into these viral factories that one virus goes in, thousands can come out per cell. So when those viruses come out, the new ones, they're just going to go on and get inside new cells. So as you're steaming, as you're describing, right? So steaming has lots of important properties, just the act, when you're, congested and a variety of other ways, steaming is recommended, and that could potentially help ease some of the symptoms. But if I'm already infected and my cells have gotten the virus in them, the steaming is not going to actually um, kill the virus that's in
Yes.
those cells already. It's
Right.
it's not. And then I don't, I don't have an actual answer for this, but my thought is I wonder how healthy it is to actually be steaming for such a long period of time. Would there potentially be, collateral damage as well to some of your cells?
Okay. Okay. Thank you. Well, that I do not know. I don't have the answer to that. But I have steamed in the past. I'll tell you that. But that was a number of years ago to fight a cold at the time, and it did help. But it's not like it was just instantly, gone. I had to
Right.
continue other regimens in order to fight off the cold. But I do
Exactly.
appreciate.
And
Go ahead. Sorry.
well, I was going to add in there, I've steamed as well, for colds and, sometimes if my asthma or actually dry heat, if my asthma was bothering me, there's different ways to get this, to breathe this heat. And it's okay, but then there's also contraindications depending on, how you're administering it, depending on do you have high blood pressure, depending on a variety of other things, the length of time that you can do it and if you can do it safely, but yes, there are properties that steaming, in this dry heat or the dry heat can actually serve to do have some positive functions in our body, which could alternatively maybe promote, better health, but it's not going to specifically stop this virus from, going on to continue to invade your other cells.
Yes. And we know that it comes through the nasal passage, the mouth, and so forth. So my next question is, what if you use a nasal saline? This is another myth I've heard. That you use nasal salines frequently to keep rinsing out your nasal passage so that you do not get the virus.
So if you're just rinsing out your nasal passages, if you happen to have simply just at that moment that you are about to rinse, maybe have been exposed to the virus, it's possible to flush it out because maybe it hasn't yet penetrated inside your cells. But again, it's one of those things where, the virus is, once you get it into your mucous membranes, it very quickly actually is going to be able to penetrate inside and then get into your cells. So rinsing of the nasal passages is not going to remove any virus that has gotten into the cells, if you understand
Okay.
what I'm saying, because it's already inside. It's one thing if it's something that circulates, or not even circulates, but that would just simply reside there.
Yeah.
But it's inside your cells. Now, having said that, as you are rinsing, are you potentially rinsing away, let's say you were infected, are you potentially rinsing away some virus and reducing it, for other people's benefit? Maybe, maybe, but you still got it in your cells. So really, I would have to say that's a myth.
Okay. So if you don't have it, it can't per se be a preventative measure.
Right. That's correct.
Okay. Okay. So also we've been practicing social distancing here in the Virgin Islands, along with the entire world. But some people feel that I shouldn't say some people, I should say young people, and I hope they don't nail me to the cross when I say this. But it doesn't seem like young people are trying to practice social distancing, and for some reason they feel that it doesn't apply to them because based on the statistics and the information that has come out, it's the higher percentage of people who will die from the disease or potentially die from the disease are individuals in a certain age bracket, which are on the older side of the population. And as of late, I've seen more statistics come out with younger people getting the virus now, but in the beginning of the whole pandemic, we saw that older people were the ones who were actually dying from the virus. So my question now, or what, it's not really a question, it's sort of a statement, because apparently social distancing doesn't seem to be something that young people want to practice. What would you tell them, being that you're a expert in infectious diseases and you're very familiar about, I mean, not coronavirus per se, but other viruses. But what would you
Right.
tell them in reference to social distancing?
I sometimes I think I just want to hit them in the heart, hit them where they might feel something. Look around, so many of us have parents. So, a 21-year-old who feels invincible has a 42-year-old parent, perhaps, and that person is not specifically out of the woods. They've got a 60-something-year-old grandparent. They've got, 90-something-year-old great grandparents, if we're fortunate enough. And even, here a lot of the times we talk about young people. Before this, I would say we talk about young people and we're really talking about, teenagers and, young 20s. At this point, when we're talking about young people with this pandemic and this virus, that age group actually expands upwards into, the 40s even. And
Yeah.
and there's a lot of people that are putting themselves in this category because that's how it's been, described, and they're also not following completely. But all of us have to. So I would say think about your parents, your grandparents, your favorite auntie, your somebody that the person at the corner store, that you've seen growing up. They're elderly, or think about somebody who's got asthma, who's got lung disease, who's got, an autoimmune disease, something else. There's a lot of that out there, right? And that makes them it makes it harder for them to fight this disease. Then think about all of your nurses and doctors and healthcare providers, right? That, some of us know somebody, if not a nurse or a doctor, somebody in the healthcare field. They're being slammed. They're getting
That's right.
infected as they get, then they're dying. Some of them are actually dying. And so what happens when there's nobody to take care of grandma? What happens when there's nobody to take care of, your favorite teacher or somebody else? That's where we're looking at. That's why this is so important to do your part. This is a situation where everybody has to do your part. And then as you mentioned, the data is now coming in that younger people are not exempt like we thought.
That's
So
right.
here in the United States, and you guys don't yet have high enough numbers to really be able to give some gauge of this yet, but what we see here in the United States is almost, I forget the exact number, but it's almost half of all the cases so far in terms of this disease and having, some higher symptoms are actually going to be found in that 18 to, I believe it was something like 54 or 56 years old. That was the people that were
Wow.
previously considered young people. So
Exactly.
maybe being young isn't the advantage that we thought, and you just now need to be more careful to protect yourself, because a good number of these young people are still getting hospitalized. Even if they don't require ventilation, they're still getting hospitalized. And then older people or people with underlying conditions are unfortunately getting sicker, and a good number of them are dying. Our numbers are rising. It's serious.
Wow. Yeah, very serious, very serious. And another myth that I've heard is that only people with bad hygiene are the ones who are getting the virus.
Oh, no, absolutely not.
Yeah.
Absolutely not. Yeah. So, bad hygiene can be described in a variety of different ways. Depends on the country you're in, depends on, the people you're talking to, what one considers good versus bad hygiene varies, right? But at the end
Yeah.
of the day, the people getting sick are people who are, I can't even say that. That would be an unfair statement. I'm going to retract that. I will say this. Everybody's getting sick across the board. It's people who are, wealthy, people who are average middle class, people who are poor, have less resources, people from every continent except for Antarctica, people who are from just about every single country of this world, and you can't tell me that 380,000 people all have bad hygiene. Those numbers
Mhm.
don't actually add up.
For
So
a
it's
while, they were saying that the virus doesn't affect Black people. And then after a while, we saw that that wasn't the case.
absolutely.
Mhm.
I don't have the final exact numbers, and that's because these numbers are rapidly changing. But, Africa is behind in terms of the number of cases, which is wonderful, actually. That's great. But their cases are over 1,100 right now. And no, not everybody in Africa is Black, but we do know that the majority of the continent is Black, right?
Yeah.
And those numbers are rising. So this is, yes, COVID-19, or the virus that causes COVID-19, is a new virus that we don't know about, but we know about coronaviruses and other viruses, and they do infect Black people, white people, Asian people, Hispanic people, people regardless of their race, their religion, their, ethnicity, and any other thing that kind of, social grouping that we stratify ourselves into. And if you just, look up what's going on in Africa, we can see that this is the case. Now, in Africa, what I've, been able to see, and there's so many different countries, so of course the response is going to differ depending on the country, but what we can see is that many of these governments are taking very swift and definitive action to shut their borders, to stop international flights, to enact a social distancing, and all
Mhm.
these things that we know can work, but they're doing it quickly. So they're not necessarily waiting until their numbers get super, super high. And we know when we look at, for instance, South Korea, when you implement certain procedures like increased testing early on and certain other things, we know it's going to help keep the caseload down. So this is what I hope to see. I know this is what a lot of people hope to see, but the case numbers are lower in Africa. But they're growing. They're
Yeah.
growing.
And I'm just want to jump out the scope of the conversation for just a quick second, and I'll jump right back in. But we mentioned
Sure.
Africa, and I think that Africa has been going through so much lately. They were having like a locust infestation. It was going from like across countries, eating all of their farmlands and food.
Right.
So I'm so glad that the numbers are relatively low in Africa compared to the rest of the world, because they're going through their own crisis concerning that locust infestation as well. So
Exactly. And parts of Africa still have, they have fallout from Ebola infection. They have fallout from, high rates of, other types of infectious diseases or other diseases. And so we're just talking about it as a continent, knowing that, of course, all these different countries have, their own various states. But overall, it would be difficult for them in any other country or area of the world that may have limited resources, or they're suffering from such really high problems like you've just described, to be able to deal with these high numbers. It's
yeah.
difficult for other places to deal with it, and they didn't have, all these pre-existing things. So, hopefully these numbers can be suppressed in Africa.
I hope so. And let's jump back to the conversation again. And my next question is, with epidemics and pandemics, often they become an opportunity for people to sort of like express their deeper worries
Right.
or stress. So do these types of actions or feelings, do they reflect negatively on your immune system or your liability concerning how strong you are to fight against the virus potentially?
Well, so if I understand your question, then you're asking if, let's say having worry or maybe being depressed, would that reflect negatively on your immune system, right?
Yes.
Okay. I mean, there is that potential because the increase, as we were discussing earlier, an increase in stress does have the potential to decrease your overall your overall immune system
Yeah.
to an extent. So prolonged, negative thoughts, perhaps, and I'm definitely not a psychologist or a psychiatrist, that's not my area of specialty, but prolonged stress as a result of that could potentially, of course, decrease your immune system. Um, and so, how do you combat those thoughts? I mean, you need to remember that we're going to get through this.
Yeah.
Pandemics, and epidemics, they look horrible. And this is horrible. Let's just keep it what it is. This is bad.
100.
This is very bad. And it's going to get worse, but we're going to get through it.
Yes.
We've seen, this is the largest scale that we have seen, but the world saw, at a huge level, an influenza pandemic in 1918 that infected millions of people throughout this entire country, the entire world, excuse me, and we lost so many people in terms of the numbers of deaths, and we rebounded. And that was 100, just over 100 years ago, right? And we rebounded. And we've seen additional epidemics as well as pandemics since
Mhm.
then, and we always get through. So if you maintain that reality and that hope and try to steer your thoughts into a more positive, pathway, overall it makes it easier to cope. And then that could hopefully help, overall stave off some of these thoughts.
I think it's important to have a good outlook and positive morale in this time, because I'm a firm believer that stress kills. It might
Yes,
not take out people as quickly as other things, but in the long run, it does.
it
For all the
does.
people that are listening out there, be positive. If nobody told you they love you today, I love you. So just make sure that you all stay on your positive note, spread the love, empower each other, help each other along the way. And that brings me to the conclusion of our show, Dr. Cadet. And again, I do appreciate you taking your time out to help us here in the Virgin Islands, all the way from Atlanta, Georgia. I know that you have a lot on your plate up there as well as a professor and what you deal with at the college as well. But we do appreciate you again for taking the time out. And hopefully, this will not be the last time that you
No.
come on again, and continue our discussions, and hopefully we can incorporate questions from the viewing audience at some point once we get ourselves together to receive those as well. So,
Absolutely.
any last words before we sign off?
Just thank you so much for doing this, for providing a platform for your viewers and your community really to ask questions. Community Action Now, you guys are always doing such good and important work and just touching the people. And I appreciate that you're doing that. You know, just your numbers are still low in the Virgin Islands. They are low. I know that they've grown by a few since we last spoke, and they're going to grow a little bit more. They are. But if everybody stays positive, like you described, and listens to your local authorities, both government as well as, health authorities, and just follow the guidelines, you too should be able to suppress or keep your numbers lower and stay healthy and have less of an impact. But let's continue to talk as you need me.
All right. Thank you. All right. Well, have a blessed day. And for everybody signing off, have a good day. Bye.
Take care.